Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, As You Age, Stay Fit, Stay Safe, presented by Larry Aseo, physical therapist with Washington Outpatient Rehabilitation Center. Larry graduated from Cal State Long Beach with a Bachelor of Science in Physical Therapy. He has been an outpatient physical therapist in Fremont for more than 30 years. Please welcome Larry Aseo.
Thank you, Christy, for that invitation. Like Christy said, I've been a physical therapist in the Fremont area, Tri-City area for over 35 years. But I've also been a home health physical therapist with professional home care for 25. And I've been in hundreds, if not thousands of homes during my career. And one of the biggest fears or challenges that I've seen in the homes is either the patient themselves or their family members have had that fall. And we've all seen that commercial on the TV where that person is on the floor and what do they say? I've fallen and I can't get up. And it reminds me of something that I tell my patients each and every day when I see them. Do you want to hear the truth or do you want to hear what you want to hear? And one of those sad truths is other than wine, scotch, and tequila, nothing gets better with age. And as we age, our muscles get weaker. Our endurance gets weaker. Our agility, our balance, our ability to move around structures decreases. And when we fail to swallow our pride and we fail to admit that our body isn't what it was when we were younger, then we're susceptible to having these falls. Now, sometimes those falls you may recover from, but other times those falls may put you in the emergency room or, heaven forbid, in the hospital. So I developed these 4 tests today that can help us to determine what our strength is, what our balance is, what our endurance, and then also our agility. And so with the assistance of Bill, he will help me to perform these tests. So I invite Bill to come up to the stage and we'll perform the first test, which is called the chair stand test. All right, so Bill, what we're going to be doing is you're going to be standing in front of this chair. All right. And the first part of the test is you're going to sit in the middle of the chair with your feet flat on the floor with your arms crossed. Okay, one foot is going to be in front of the other. Your stronger leg will be behind. Okay, I'm going to get my stopwatch ready. Okay, and when I say go, I'm going to have you stand up as many times as you can in 30 seconds. And I'll count how many reps you can do. Okay, are you ready?
Ready.
Okay, on this count of 3. 1, 2, 3, and go. 2, 3, 4, 5, 6. Okay, perfect. Thank you, Bill. How do you feel?
Good.
Good feeling in your legs?
Oh, yes.
So what that test was for is, again, to check your leg strength. All right? Okay, so thank you. Okay, we're going to be going up to the next test, and this test is called the timed up and go test. And the purpose of this test is to assess your agility and your dynamic balance. You will still use the same chair, and then we marked 8 feet on the floor. Can you see it, Bill?
Yes.
Okay? So what the task is going to be, I'm going to have you, when I say go, I'm going to have you stand up. You're going to walk around the tape and then back to the chair and then sit down. And again, I will be timing you. Are you ready?
Ready.
Okay? On the count of 3, 1, 2, 3, and go. Perfect. All right. Thank you, Bill. And now we are ready for the next test, which is what we call the 2-minute step test. All right. So, Bill, I'm going to have you stand up. Okay. And we have this stool that's marked here, and there's a tape that's marked on the stool. And what that indicates is the height that Bill will have to lift his leg. We're going to count how many times Bill is able to lift his leg to the height of that step. Okay, you could say he's marching in place, which will check not only his leg strength, but also his leg endurance and also his heart endurance. Okay, are you ready, Bill?
Ready.
Okay, so I'm only going to count when you lift your right knee up. All right, so when I tell you go, we'll start. Okay, on the count of 1, 2, 3, and then go. 1, 2, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 3, 4, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 1, 2, 3, 4, 5, 6, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90. And stop. How do you feel, Bill?
Good.
Good. How do your legs feel?
I'm a little tired.
A little tired. How's your breathing?
Normal.
Normal. Okay. So again, this test will check your cardio and also your leg endurance. All right. Okay. So the next exercise or test that we're going to be doing, one of the things that I failed to mention on these last two tests is that those of you at home, if you, with either the walking test or this one, if you need to use a walker or a cane for balance or support to perform the test, then that is something that you can do. All right. Okay. Now the last test is what we call the one-legged balance test. All right. So this checks your static balance, your control, and your fall risk. So what I'm gonna be looking for, Bill, is don't do it yet. I'm gonna have you stand next to. We have the stool just in case if you lose your balance. You will have your arms folded, and when I tell you go, you're gonna lift one foot up. Don't do it yet. And what we're looking for is if your raised foot touches the ground, then of course you lose your balance. Or if your foot on the floor loses control, that also would be a point of that you would have to lose your balance. Or maybe your raised leg, you would have to touch your standing leg, and that would indicate that you're losing your balance. Okay, so those are the three things that I'm looking for when I start this test. Okay, so let me reset my timer. Okay, and on the count of 3, we're going to start. 1, 2, 3, and then raise one foot. So I can see your ankle is kind of quivering a little bit, but your foot is in still contact with the floor. Your arms are still across your chest, and your other leg has not touched the other leg to give you support. Right now we're at 20, and then 25, and 30. Okay, go ahead and you could put both feet down, all right? Okay, and then just, I'll let you rest for like 5-10 seconds, and then I'll have you repeat on the other leg. What some people may encounter is that one leg may be better than the other one. So if this is the case, you may be somebody that may need to use a cane. And if you do need to use a cane, you would put the cane on the side opposite of the leg that has the less balance. Okay, because some people need a cane, but they don't know which hand to put it in. It doesn't automatically go in your dominant hand. Okay, if you had problems in your left leg, you would put the cane in the right hand. If you had balance problem on your right leg, you would put the cane in the left hand. And that's always a challenge for a lot of people. Okay, are you ready? All right, let me reset my stopwatch, and on the count of 3, we'll start. 1, 2, 3, and lift up your leg. I could see you're having a little bit harder time to balance on the left leg.
Yes.
There you go. That's it. Okay?
Yeah.
So it was 14 seconds. So what that showed is that, yeah, your balance is a little bit less on your left leg than on your right leg. Your right leg is probably your stronger leg. Many times the stronger leg is the leg that has better balance. So if Bill was having a problem with falls in the home, it may be an indication that you may need to use a cane. And for you, since the left leg was a balance problem, you would put the cane in your right hand. All right? Thank you, Bill, for helping me with this demonstration. Okay? And at this time, this concludes the testing, and I will be going to the podium and I'll be answering any questions that anybody may have.
All right, thank you so much, Larry. That was great, and thank you, Bill, for that great demonstration. You did a great job. So one of the questions we have today is, how often should I perform these tests?
One of the things that's nice about the tests is it's something that can be done on a daily basis. And sometimes what I would recommend to patients is do it at different times of the day. Because in the morning, a lot of times you're a little bit more tired or weak. So if you did do the chair stand test, you may notice I can't get up out of the bed. I can't stand up. Okay, my balance is a little bit worse. We all have our challenges first thing in the morning, but sometimes guess where those falls would happen? In the morning. A lot of times what we notice is where the most falls happen is in the bedroom, right next to the bed, or in the bathroom. And for many of us, what's the first thing we have to do when we get up in the morning? Get up, go to the bathroom. That's where a lot of falls happen. So I would recommend that if you are going to do these tests, try them in the morning. But then afterwards, you may have to do it later in the day, okay, when you have your breakfast, especially if maybe your medicines, if you're a diabetic, maybe, your blood sugar is the reason why you're unsteady. Okay?
Okay, great. The next question we have, are these tests also a form of strength training?
Yes, they are. And that's why I picked these tests. Because as you can see with the chair stand test, it checks your leg strength. So as you can see on the slide, okay, there's a range for both men and women based on your age group. And what that slide indicates is what your normal strength range should be. Okay? And so if you fall within that category, then you have normal strength for your sex and then also for your age. But if you fall below that, then that's an indication that your leg strength is getting weak. So this same test that you did, you can do as an exercise. And you could do it maybe once or twice a day, and setting a goal to increase so that you would hit at least your normal range, and even better if you can get beyond it. Same thing with the 2-minute step test. It checks your endurance. So as you can see on the slide, there's so many repetitions that you should be able to do. So if you notice that, when I walk to go and get the mail, okay, I get tired. Well, maybe that's the reason why. Your leg strength or your endurance is low. This exercise is also something that you can do if it's weather's challenging. We're getting into the fall where maybe it's too cold or it's rainy outside. When I used to be a home health physical therapist and I had to keep my patients indoors, this is what we would do instead of going walking. I would have them do the 2-minute step, rest, and then we would do it again. So you could do this maybe 1, 2, 3 times, and it would be the equivalent of maybe walking outside for 5 or 10 minutes. The timed up and go is just something that you can practice in terms of your agility of being able to walk around the house. Sometimes what happens is when we get up so quickly that we lose our balance, and if there's nothing steady, you may trip. Sometimes what happens is the doorbell rings or the telephone rings, and then you're getting to go up and answer the phone and you're not paying attention to what's happening. So all of these situations occur in our daily lives, and all of these can be causes for falls. And the last one, in terms of balance, like you saw with Bill, one leg may be strong and you think that that's the same, but if you never check your other leg, you may not have noticed that one leg is a little bit weaker. If you fail or you are below normal on 2 or maybe 3 of these tests, this can be an indication that you may be at risk for falls. Practice the exercises every day, but if you notice that you're still coming up short, that may be an indication that you may have to go and see your doctor and maybe have him write a prescription to go to physical therapy. We can treat you and we can teach you exercise to get stronger. We can teach you exercises to work on your balance, and we can do what we call gait training, so we can teach you how to use that cane or that walker so that you can prevent from having that fall.
Okay, great. I think you answered one of the next questions. How will I know when I need to use a walker or cane? That does relate to these tests. Is that correct?
That is it. Okay. So these tests will give you the indication that, one of the things that's hard in our life, and I think we've all had friends or family members where they should use a walker, but they don't want to use it. They leave it aside. And I've seen that so many times. Sometimes we have to, like I tell my patients, swallow our pride and acknowledge that I need a little bit of assistance. We all need assistance in our life. And we don't want to see that person who falls, and the next time you're seeing your doctor is not for a referral or for your 6 months checkup. It's because you're fallen, and now he has to send you therapy because you broke your wrist, broke your hip, or maybe you're in a nursing home.
Okay, and this last question is somewhat of a statement. My doctor told me that it might be a good idea if I use a cane, but I don't really know how to use it. How can I learn how to use a cane or a walker?
Good question. And that would be where physical therapy comes in. Okay, have them write an order for gait training, okay, or ambulation training. And that's what we do in our clinic. Just like I showed with Bill, if his balance problem is on his left leg, we would teach him how to use a cane in the right hand. And then what we also do is we challenge our patients. So we have these little balance devices where it simulates like how many times when we walk outside, those sidewalks aren't completely level. Okay? Or that step that we have, it's too small. So we have to have, you may have stairs in your house. Okay, are you climbing up and down the stairs the correct way? If one leg is stronger or weaker than the other, I will tell my patients go up with the stronger leg. So these are all things that we can teach you in the physical therapy clinic. And that's why I'm here, is to offer our services to any of our community so that when we teach you, we are teaching you to prevent the fall rather than the fall that may have happened.
Great. Well, thank you, Larry, for answering all the questions, and this does conclude our program. Thank you also for this insightful presentation, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.